Friends, good morning. Do you know whether any lucrative areas are there for clinical Ayurveda practice? So it is a common question. Many of you may be having that Ayurveda clinical practice is not as lucrative as of allopathic practice or any other streams of medicine rather. But sorry to say that you have got a misconception. There are a lot of lucrative areas are there where clinical Ayurveda practice can be helping. Okay, so the basic thing is that now world is narrowing down. So if you want to make your impact as an what you call the clinician, as a clinician, you need to narrow down your niche, or rather you need to specify your expertise. So when you specify your expertise in a particular what you call the diseases, then you'll be easily branded and you'll be easily visible to the world as an expert of the particular disease. So rather than being a general Ayurvedic physician, if you focus on your what you call the particular mastery of the disease, a particular disease rather, where you are expert in all the aspect, and you'll be the ultimate what you call the uh, expert to deal with that disease. If that is, if you are able to impress upon the population or the what you call the, in the patient community, then definitely that becomes a lucrative area for you. For example, now many of the practitioners are there. They are practicing with a particular what you call the disease, like some may be known as Ayurvedic proctologist, who is practicing only the proctology, and because of that he has been easily identified. Many of them they are practicing urology. Okay, they are known for that. Like even see, proctology is the one which is, of course, people look to that rather than the allopathic medicine. They prefer to come to Ayurvedic what you call the speciality. So uh, neurological conditions like piles, fistula, fissure, that is the area which you can look into. Second is the urology, wherein the benign prostatic hyperplasia, urethral stricture, and non-complicated urinary calculi. Okay. Third is biliary calculi and biliary what you call the complaints. Fourth is of course hepatobiliary, as I told, and fifth one is the skin. Okay, so dermatology is the best one which can be concentrated on, and if you practice only dermatology, you can earn name, fame, as well as the wealth also. And of course the degenerative disorders, age related, like arthritis. Okay, and the the what you call the neurological problems, especially the degenerative changes like uh, the Parkinsonism, Alzheimer's disease you can practice, because as per my experience, even allopathic medicine doesn't have the specific or the definitive what you call result yielding procedure, means medicines as well as the procedures. So the procedures are there very cost, they are not cost effective for the common people. So there at least you can support the patients. And other than that, uh, gastroenterology, wherein especially IBS, irritable bowel syndrome, where you can give a better result with Ayurveda. So you position yourself as expert of the particular single disease, so that you can make your impression, and of course you will be having the mastery on that particular disease. You'll have to supposed to focus only on that. So come out of that what you call the myth or the concept or the illusion that you will be treating all the disease. Lifespan is very small, and this is a competitive world, and try to position yourself as a expert of only one or two disease of a particular system, and that will help you to position yourself as unique one. Okay, it will be unique proposition of your brand, and you will definitely attract, and that becomes a lucrative area for you over the period, and you will be called as expert. You will be looked up as an expert in that particular disease. So hope you'll narrow down your disease expertise and you'll brand yourself with that particular disease. And all the best for your clinical practice.